Today, we're exploring sarcoidosis, a condition where your immune system gets confused and overreacts, causing unexpected changes in your body. It's a disease that can be puzzling, both for patients and doctors, because it doesn't always follow the same pattern in everyone. Instead of just fighting germs and infections, your immune system forms tiny clumps of inflammatory cells called granulomas. These clusters are the body's way of trying to wall off something it sees as a threat, even if there's no real danger present. These granulomas are like uninvited gatherings that can show up almost anywhere in your body, but most often in the lungs and lymph nodes. They can also appear in the skin, eyes, heart, or other organs, making the disease unpredictable. While they aren't cancerous, granulomas can disrupt how organs work, sometimes causing symptoms like cough, shortness of breath, or fatigue. In some cases, people may not notice any symptoms at all. For some, sarcoidosis is temporary, and the granulomas disappear on their own, often without the need for treatment. This can be a relief, and many people recover fully. For others, it can be more serious and long-lasting, requiring ongoing care and monitoring. Chronic sarcoidosis can sometimes lead to permanent organ damage if not managed properly. The disease looks different in everyone, making it complex to understand and manage. Doctors often need to tailor treatment plans to each individual's needs and symptoms. Sarcoidosis isn't contagious. You can't catch it from someone else, and it doesn't spread through families in a predictable way, though genetics may play a small role. The exact cause is still a mystery, but granulomas are the key feature that doctors look for when diagnosing sarcoidosis. Research is ongoing to better understand why the immune system reacts this way. Learning about granulomas and how they affect the body helps us treat symptoms and support people living with the condition, improving quality of life. The goal is to replace confusion with clarity and fear with facts, so you can feel more confident about your health and your future. Many people with sarcoidosis lead active, productive lives, managing their condition with the help of their healthcare team and support from loved ones. Understanding what's happening inside your body is the first step toward taking control and making informed choices about your care. By breaking down this complex topic, we empower you to have informed conversations with your doctor, ask the right questions, and advocate for your health. Remember, the name sounds intimidating, but there are many ways to manage it, and you have a team ready to help you every step of the way. Knowledge is your best tool. The more you learn, the more prepared you'll be to face challenges and celebrate progress. Let's get started on this journey together, supporting each other and building a community of understanding. Sarcoidosis may be complex, but you're not alone. With the right information and support, you can move forward with hope and confidence. Sarcoidosis is like a case of mistaken identity. Your immune system, which is supposed to protect you, suddenly turns on your own body. It attacks healthy tissue, forming clusters of inflammatory cells called granulomas. These granulomas are the body's way of trying to wall off what it thinks is a threat, but in reality, there's nothing harmful there. These clumps can interfere with how organs work, much like adding unnecessary parts to a finely tuned engine. Imagine if someone started putting extra bolts and wires into your car's engine. It wouldn't run as smoothly, and over time it might even break down. That's what granulomas do to your organs. The lungs are the most common site. Over 90% of people with sarcoidosis have lung involvement. This means that for most patients, breathing can become a daily struggle, and even simple activities may leave them short of breath. Granulomas in the lungs cause inflammation and scarring, making it harder to breathe. Over time, this can lead to persistent cough, chest pain, and a feeling of tightness or discomfort. Lymph nodes, especially in the chest, can also swell. This swelling can sometimes be seen on scans before symptoms even appear, making early detection tricky. But sarcoidosis isn't limited to the lungs. It can affect the skin, eyes, heart, nervous system, liver, spleen, and even bones and joints. Each organ can show different symptoms, making the disease unpredictable. This wide range makes the disease challenging to diagnose and manage. Doctors often need to piece together clues from many different parts of the body. Symptoms and severity vary greatly from person to person. Some people may have only mild symptoms, while others experience severe, life-changing effects. Some have mild symptoms that resolve on their own, while others face chronic multi-organ involvement that requires ongoing treatment and monitoring. Wherever granulomas form, they disrupt normal function. This can lead to fatigue, pain, and a host of other issues depending on which organs are affected. The body is fighting itself, and the symptoms depend on where that battle takes place. It's a constant struggle between the immune system and the body's own tissues. Understanding this helps explain why sarcoidosis looks so different in each person. No two cases are exactly alike, and each journey is unique. The key is recognizing the signs early and working closely with your doctor for the best care. Open communication and regular checkups are essential. Every case is unique, but knowledge is power. By learning about sarcoidosis and staying informed, you can take control of your health and improve your quality of life. Sarcoidosis symptoms are diverse and often subtle, making them easy to overlook or mistake for other conditions. This disease can affect people of any age, gender, or background, and its signs may come and go or linger for months. Many people feel extreme fatigue, fevers, or unexplained weight loss. These symptoms can be persistent and may interfere with daily life, making even simple tasks feel overwhelming. Swollen, painful joints are common too. Joint pain can move from one area to another, and sometimes swelling is visible, especially in the knees or ankles. Lung involvement brings a dry, persistent cough, chest tightness, and shortness of breath. Some people may also experience wheezing or discomfort when breathing deeply. If you have a cough that won't go away or get winded easily, talk to your doctor. Early evaluation is important, especially if you notice these symptoms lasting more than a few weeks. On the skin, look for red or purple bumps, often on the shins, called erythema nodosum, which can be tender to the touch, or patches of discolored skin, which may appear lighter or darker than your normal skin tone and sometimes feel rough or raised. Old scars may become raised and purple, a unique sign that can be easily missed if you're not looking for changes in old injuries. Eye symptoms include blurry vision, pain, redness, or a gritty feeling, and sometimes even sensitivity to light. Light sensitivity. See a doctor right away for any vision changes, as untreated eye involvement can lead to serious complications. Some people have no symptoms, and sarcoidosis is found by accident on a chest X-ray done for another reason, such as a routine checkup or unrelated illness. Symptoms can appear suddenly and disappear, leaving you feeling normal for weeks or months, or develop slowly and persist, gradually affecting your quality of life and making it harder to pinpoint when the problem began. Listen to your body. Don't ignore ongoing fatigue, unexplained pain, or changes that don't resolve on their own. Cough, skin changes, or any new symptoms should be discussed with your healthcare provider. Early attention leads to better outcomes, and prompt treatment can help prevent complications. Sarcoidosis can be sneaky, so awareness is crucial. Educating yourself and staying alert to changes is the first step in managing your health. If you notice a combination of these symptoms, seek medical advice. Don't hesitate to reach out for help or ask questions. Your body's signals matter. Pay attention and take action if something feels off. Diagnosing sarcoidosis is like solving a puzzle. There's no single test. Doctors start with a physical exam and a detailed discussion of your symptoms. Imaging tests like chest X-rays or CT scans look for enlarged lymph nodes or lung inflammation. If something unusual appears, more detailed scans or a PET scan may follow. To confirm the diagnosis, a biopsy is often needed, removing a small tissue sample to look for granulomas. The lung is the most common biopsy site, often done with bronchoscopy. Blood tests check for inflammation and organ function, but there's no specific blood test for sarcoidosis. Doctors rule out other diseases before confirming sarcoidosis. Diagnosis comes from piecing together your symptoms, imaging, biopsy, and lab results. It's a careful process, but it leads to the right treatment. What causes sarcoidosis? We don't know for sure. Scientists believe it's a mix of genetics and environmental triggers. If you're genetically predisposed, something in your environment like dust, chemicals, or certain infections might trigger the disease. Most people exposed to these things never develop sarcoidosis. It's a rare reaction. Risk factors include being between 20 and 40, African American or Scandinavian ancestry, and having a family history. Genetics play a role, but anyone can develop sarcoidosis. Understanding your risk helps doctors identify and monitor those more likely to be affected. The search for a definitive cause continues. The good news: many people with sarcoidosis get better on their own. If symptoms are mild, doctors may simply monitor you with regular checkups. When treatment is needed, the goal is to reduce inflammation and prevent organ damage. Corticosteroids like prednisone are the mainstay, shrinking granulomas and easing symptoms. Long-term steroid use can cause side effects, so doctors may add steroid-sparing drugs like methotrexate. These help control the disease while minimizing risks. In severe cases, treatments like oxygen therapy or rarely organ transplants may be needed. Every treatment plan is personalized to your symptoms and organ involvement. The focus is always on balancing benefits and side effects. With the right approach, most people manage sarcoidosis well. Managing sarcoidosis isn't just about medication. Your daily choices matter. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins to fight inflammation. Avoid processed foods, sugary drinks, and unhealthy fats. Gentle physical activity like walking, swimming, or yoga can boost energy and keep joints flexible. Listen to your body and start slow. Talk to your doctor before new exercise routines. Prioritize rest. Aim for 7-9 hours of sleep and take breaks as needed. Learn to pace yourself and manage your energy. If you smoke, quitting is the most important change you can make. Avoid dust, chemicals, and airborne irritants to protect your lungs. These lifestyle changes empower you to take control of your health. Partner with your doctor for the best results. Small steps add up to big improvements. You have the power to influence your well-being. Healthy habits make a real difference. Let's meet Sarah, a teacher diagnosed with sarcoidosis 5 years ago. Her journey began with a stubborn cough and exhaustion she couldn't shake. After tests and uncertainty, she was relieved to have a diagnosis, but worried about the future. Prednisone helped her breathing but brought side effects like weight gain and insomnia. Sarah learned to advocate for herself, tracking symptoms, joining a support group, and making lifestyle changes. Gentle exercise, a healthy diet, and prioritizing rest gave her more control. Today, Sarah's sarcoidosis is in remission, and she's off daily medication. She still has regular checkups and knows flares are possible, but she's no longer afraid. Her story is about resilience, finding strength, support, and hope. A diagnosis isn't the end, it's a new beginning. With knowledge and support, life with sarcoidosis can be full and meaningful. Sarah's journey shows what's possible. If you or a loved one has sarcoidosis, know that there's hope. Most people manage the condition well, and many see symptoms improve or disappear. Effective treatments and new research are making the future brighter. Scientists are working on better diagnostics and safer therapies every year. Building a strong support network, medical team, family, friends, and patient groups makes a big difference. Don't hesitate to ask for help or connect with others. Remember, sarcoidosis is just one chapter in your life. Stay informed, work with your doctor, and embrace healthy habits. Optimism and knowledge are powerful tools. You can live a vibrant, meaningful life with sarcoidosis. The future is bright. There's always hope.